Hey everyone. Okay, so let's talk brain chemistry and gut health because this is so critical if you have a child with a behavior issue or with a learning issue. So basically, you've probably heard your child's second brain is in their gut or your second brain is your gut, and that's absolutely true. And it's really important to understand this connection, not just with things like autism and ADHD, which often gets, thankfully, a lot of attention that if you want to improve behavior, emotional regulation, and so forth, then you want to work on gut health. But this is definitely 100% true and valid with learning difficulties as well, which often gets very little attention. So your child has 100 billion neurons in their gut. And if that doesn't convince you about how important gut health is to brain function, then also understand that basically not all, but many of the neurotransmitters that your child needs to focus, learn, regulate, all that type of stuff, memorize, is manufactured by the gut bacteria. So if your child has a history of antibiotics, which a lot of our kids do, I'm not knocking these, they totally can be necessary at certain points. But if they have digestive issues, eczema, allergies, asthma, any kind of immune issues, and so forth, likely they have some issues with brain health. And that could be focus, attention, emotional regulation, learning, and so on and so forth. But all of this ultimately points to biochemical imbalance. So what I see is moms addressing a whole bunch of what appears to be individual challenges or health issues and so forth as if they are separate. So they're using creams for eczema and stool softeners for constipation and tutoring for reading difficulties, and they're going to see a behavior therapist for their child's ADHD and so forth. And first of all, not knowing all of this is connected, and that some of these interventions, if they are just the only intervention and there's no other kind of follow up with that, can actually prolong the problem or even make it worse, like using, Miralax to get your child to go to the bathroom and so forth. So, and ultimately this means that you have a 16-year-old down the road who still has digestive issues because that's really hasn't been addressed, and probably still has learning or behavior issues. And really this is, if you look at why your child is further behind in school compared to their peers, it's not because of a deficiency in tutoring or deficiency in Ritalin. It has more to do with what's going on with them biochemically as well as neurologically. So Dr. Natasha Campbell-McBride, creator of the Gut and Psychology Syndrome Protocol, discovered in the 1980s the connection that kids with learning disabilities, ADHD, autism, and so forth, most of them had compromised gut health. She found, number one, that bad bacteria allows toxins to impair brain function. Basically, these toxins are absorbed into the blood and cross the blood-brain barrier, entering the brain, and that's where we end up with a disrupted biochemistry or brain chemistry. And then number two, as I've mentioned, the bacteria in the gut manufactures many of the neurotransmitters and brain chemicals that your child needs to be able to learn, focus, concentrate, memorize, and all of those types of things. So if this seems like still kind of hard to wrap your mind around, let me kind of put this in perspective, because maybe some of these neurotransmitters, because some of them are very common in kind of our pop culture, if you will. So you've likely heard about serotonin. We think of it as kind of the sunshine neurotransmitter. It makes us feel really happy and so forth. 85% of that is manufactured by the gut bacteria, and it will impact processing speed, memory, mood, sleep cycles, and so forth. So very important that your child has optimal serotonin, and if their gut bacteria is compromised, that might not be the case. Another one, dopamine, very much connected to ADHD and even learning difficulties, is really critical for executive function, right? A lot of our kids have poor executive function, which I talked about last month, all month. Dopamine can affect motor control, motivation, as well as feelings of pleasure. GABA, another one that can be manufactured in the gut, is associated with focus, mood, sleep, and very common in cases where there's ADHD or anxiety. In fact, I sometimes use the GABA supplement temporarily to help kids who, they're the kids that have so much anxiety they can't seem to get on the bus in the morning. Last one that I want to talk about is glutamate. This is super interesting. When this is low, it is associated with intellectual disabilities and delays in physical development. So you can see not only the impact that happens when these neurotransmitters are low, but why gut health is so important to basically improve these, situations and challenges and so forth. So if you want to learn more about how healing the gut and optimizing brain chemistry naturally can help your child to overcome their learning and behavioral difficulties, then you want to check out my free training this Friday, 12 p.m. Eastern. There will be replays for anyone who signs up. I'm going to be talking about the biology of learning and behavior. We'll be talking all about the different things that could be influencing your child's brain chemistry that often does not get looked at. And I've ranted about this before, and I will continue to until it gets the attention it deserves. And that is that, whenever we're in an educational setting like a school, whether it's IEP meetings, parent-teacher meets, psycho-ed evaluations, spec head meetings, any of that type of stuff, food never gets the attention it needs in terms of this could be a factor in why this child is having a hard time learning. And I'm not saying that as a former teacher that teachers should now take on that job. I think that's totally out of their scope, but it should be a recommendation or a factor that does get considered when kids are struggling with learning, reading, and of course, focus, attention, and behavior. Because if we leave that piece of the puzzle out, we are absolutely not going to, probably totally overcome this challenge. We're going to be maybe getting by and coping versus, creating the opportunity for your child to truly thrive. So I will put the link to sign up for that training in the comments below. And if you have any questions, reach out. And if you'd like to know more about my 6-month program, I will put a link for that in the comments below as well. Have a fantastic day, everyone. Take care.